This is our 23rd pandemic video. I want to thank our team for stepping up and caring for the highest number of patients we've ever seen in recent years. Every winter, our volumes increase as snowbirds and tourists arrive. This year, the start of our busiest season collided with Omicron surge. The capacity has been stretched very thin, but the opening of our oncology tower and the SMH Venice Hospital helped to meet the increased demand. Many thanks to the over 350 employees who helped out in our labor pool. We could not have done it without you. The Omicron spike may be behind us, but we are still very busy with our seasonal volumes. When past surges ended, we saw a quick and steep decline in our census. However, with Omicron, it declined much more slowly. Our peak COVID census was 191 patients back on January 24th, and we're down to in the 20s today. Fortunately, people with Omicron haven't been as severely ill as they were with Delta. We've seen fewer hospitalizations and fewer patients needing critical care and ventilators. Now that cases and transmission rates are at low levels and we're trying to open up more, last week for the first time we began to allow limited visitation for our COVID patients. When the pandemic started, we and other hospitals restricted visitation to help manage a new virus that we really didn't know much about. Today, we know a lot more about how to treat and prevent COVID. Now with cases declining, we wanted to roll out a policy that allows COVID patients and loved ones to be together. Of course, we continue to require masks for everyone coming through our doors. We've developed these guidelines in consultation with our infectious control experts. We know COVID may be with us for the foreseeable future, and we want to get back to a more normal. We plan to open up visitation further in the near future. I'd like to switch gears for a moment and talk about some exciting new projects coming online in our system. We'll be starting work soon on our new Cornell Family Behavioral Health Pavilion on our main campus. It will replace our aging Bayside Hospital, and we'll have a groundbreaking ceremony for the new pavilion at the end of this month. If all goes well, it's scheduled to open in the fall of 2023. It'll be a state-of-the-art facility that will include both inpatient and outpatient services. We will continue to expand capacity and upgrade our existing facilities. For instance, we are opening more inpatient rehab beds to meet the demand. Our rehab program was recently named among the top 50 in the nation by U.S. News. We are also working to expand our Venice Hospital as quickly as we can. We've had extremely high census there. When we opened in November, we knew we would be busy, but we didn't know we would be completely full within the first week of operations. Certainly it's been a challenge, but we are excited about the opportunities that we've been able to bring to those people who live in Venice and the surrounding areas. And we look forward to having great growth going forward. Throughout this pandemic, we've received an outpouring of support from the entire community. The number one thing everyone can do to support our team is to do what they can to stay safe. Please get vaccinated and get a booster if you haven't yet. We just want to once again thank our staff, our community, those who've come together and supported us over these last 2 very trying years, and just say thank you. We're going to get through this together as a community.